So we looked at hospitalization rates as well as opioid inpatient-related mortality in the general population as well as the sickle cell disease, as well as among individuals with sickle cell disease hospitalized in the United States over a 16-year period from 1998 to the year 2013. And just as a background to our study, I think an earlier study that looked at hospitalization rates through the year 2008 had reported that the hospitalization rates in those with sickle cell disease had been stable over that 10-year period following the FDA approval of hydroxyurea in the United States. However, since the year 2000, the opioid epidemic has been described in the United States, describing the marked increase in rates of deaths as well as toxicities related to opioid use in the United States. So we looked at an inpatient database, the National Inpatient Sample, which captures roughly 20% of all hospitalizations in the US, and looked at deaths related to opioid use, specifically in the sickle cell disease population as well as the general population. And the first chart here shows similar results with the prior study that had been reported in 2008, which suggests that overall, over the 16-year period, in the overall sickle cell disease population, the rates of hospitalization were stable. There was a slight decrease in rates through the years 2002, 2003, but if you exclude the rates for those years, you could pretty much draw a straight line from 1998 to 2013. So summarily from this slide, it appears that the rates were stable. However, what's not obvious on this slide becomes more obvious when we looked at the rates of hospitalization by age. Among those who were aged 18 to 44 years, the rates increased by 3.7%, from about 43 per 100,000 to 71 per 100,000 persons in 2012 and 2013. And the steepest rates were found among those who were aged 65 years and above. The rates actually doubled from 2.7 per 100,000 to 5.4 per 100,000 in the year 2013. And then when we looked at the rates of hospitalization by length of stay, we examined this to see if the rates of hospitalization for short stays might have one way or the other influenced the rates of hospitalization we saw in the overall population as well as the hospitalization by age groups. And what we found out was that there was some increase in the rates of short stays, that's hospitalization rates for those who were hospitalized for less than 1 day. But this was mild, and the chart on the left, the inserts, demonstrates that there was a significant rise in the rates of short stay hospitalizations. However, most hospitalizations the rates were driven by the long stay hospitalizations, defined as those greater than 1 day, for which we found out that the rates were variable and overall did not demonstrate that there was any change in long stay hospitalization rates. And then looking at opioid-related hospitalizations in patients with sickle cell disease as well as the general population, what we found out was that the rates were pretty much they were stable in the sickle cell disease population, save for the drop in 2002, which we could not quite account for. And the rates in the sickle cell disease population was also similar with the rates that we see for the general population. You see that the curves pretty much are stable if you exclude the rates for 2002 in the sickle cell disease population. So suggesting that the rates in the sickle cell disease population was stable compared with the US population. However, when we look at the general inpatient mortality pattern amongst patients with sickle cell disease from the year 1998 through the year 2013, we don't see any significant change in hospitalization rates. And the p-value for this was 0.59, suggesting that the rates were stable through the study period. And this chart here compares the rates of opioid-related deaths in the US population versus the sickle cell disease population. And the chart on the left just demonstrates that in the general US population, there's been a steep rise in opioid-related deaths related, those are deaths related to opioid overdoses in the United States, the general population. And the rates increased by about 350% over the entire study period, rising by about 8% annually from 1998 to 2013 in the general US population. However, in the sickle cell disease population, opioid-related deaths in the inpatient setting was almost non-existent, and that we see on the left. And actually, in that population, over the 16-year period, there were only 9 deaths that were reported, suggesting that opioid-related deaths in the inpatient setting among those with sickle cell disease is almost a never event. So what were the conclusions from our study? We find out that opioid hospitalization rates appear to be rising, at least among subgroups, among adult subpopulations with sickle cell disease. Those are those aged 18 to 44 and those who are elderly above 65. And this begs the questions, why? While we didn't exactly examine that in this study, prior literature suggests that this might be related to fragmentation of care in the adult sickle cell disease population, as well as an increase in age-related pain-related medical comorbidities. And the implication for this is that we need further patient-level analysis to try and identify adults with sickle cell disease who might be driving these trends, particularly those aged 18 to 44, who account for the majority of hospitalizations in those with sickle cell disease overall. Then we also found out that opioid-related hospitalizations are stable in the sickle cell disease population compared with the US general population. And finally, we found out that opioid-related deaths in the inpatient setting are almost never seen with sickle cell disease patients, unlike the general population in whom we've seen a steep rise in opioid-related deaths in the inpatient setting. So overall, this suggests that the present patterns of use of opioids in patients with sickle cell disease, this overall, it appears that this is safe, and opioids should not be withheld from those with sickle cell disease when indicated, provided that we continue the present risk mitigation strategies. Thank you.